He has cross-section data for 50 US states. As an aside, I should say, one of my favourite activities with my daughter when she was a child was I would challenge her to tell me all the US states alphabetically, the 50 of them. And she got too good at that, so I said, okay, let's do the state capitals. Now that is tricky, because they're not always the big cities, they're sometimes funny little places. Anyway, the 50 US states, which I'll give you alphabetically if you need them later. Actually, if the computer fails again, we can get on to what are the US state capitals alphabetically. Anyway, so he's got data at state level at a particular point in time, hence cross-section data, for all 50 states. He's got data from Putnams Index of Community Social Capital to capture aspects of social capital outside of the family. He's then particularly concerned in this paper to argue that too often the family and its contribution to social capital has been left out. And if we look at, we'll look again at Putnams Index, which I did introduce on Friday, and it is true that Putnams Index doesn't really seem to capture family. And so Folland is very keen to argue that an important element of, not just Folland, but he is particularly keen to argue that an important element of social capital is the family element. And so his measure he has available to capture that is the percent married. And it does say married, not percent in partnership. And the third measure he considers for social capital is average family size. Now again, it's the idea of the bonding social capital within the family. The bigger the family size, there might be more social capital. His particular argument is the larger your family size, the greater the increase in the valuation of your own health. So suppose in the extreme, if you're a family of one, you care about your health, maybe, but you don't care so very much. If you're a family of two, you care a bit more because you're not thinking just of yourself, you're thinking of the other person. Now, I don't know how far this goes, but family of 10, maybe you care even more about your health because there's all these other people in a relationship with you. So I think there's a plausibility about that. So those are his three measures of social capital. He introduces some what he calls control variables. These are factors that he argues might influence health. And he wants to control for them because he's trying to isolate the impact of changes in social capital or differences in social capital, different levels of social capital. And so he wants to control for other factors which might be influencing health. And he argues there's an education might be one. And so, again, of course, it's highly measurable. What percentage of the statewide population have a BA or bachelor's, baccalaureate degree? Personal income per capita, again, highly measurable. And so he's got the average income per capita. That should be personnel. Never mind. I transcribed it from Folland. He's got personnel income per capita. Higher income tends to have a beneficial effect on health. And poverty rate, the idea there that the proportion of households who are below some defined poverty line, the greater that proportion, that's going to have a downward impact on the average health in the state. What I'm suggesting here is, might these things not also influence social capital? Maybe if you've got higher income per capita, you're more willing to trust people because you can survive a few setbacks more easily. I don't know, if you're wealthier. That's a good question. Do wealthy people trust people more than poor people trust people? What do you think? Do wealthy people tend to trust others more or less than poor people trust others? Well, I don't expect you to have a sort of statistic in your head and that sort of thing. Do you have a view? Do you think it's possible there might be a relationship between the level of trust and income levels? I'm seeing one nod. Okay. What about education? So a higher percentage with reaching this level of sort of undergraduate degree. Do you think a higher percentage of people in an area, in a state, might be associated, or might more than be associated, might influence, might be related to social capital? So anyway, Folland includes these, as it were, to control for differences in health. But he might be introducing a problem here by putting these things in. If they are related to social capital, that's going to kind of make it hard to argue that up here he's identified the link to social capital. Anyway,
Excuse me.
yeah.
Personal income per capita and poverty rate, they stand for the same thing, or?
They're different measures, yes. I mean, the underlying concept here is level of income somehow defined, or level of wealth, some sort of measure of socioeconomic advantage or disadvantage. That may be a determinant, one of the determinants of health. These are alternative ways of measuring it. Of course, they won't always move perfectly together, so they might each contain a bit of information. But yes, I think you could see them as the same, different measures of the same concept. Okay, just remind you about Putnams Index. Now, this is available for certain years for all the US states. So that was one reason why Folland used it. But I remind you, as Folland emphasises, the family doesn't really come into this. Well, it doesn't come into this. It's maybe a good point Folland's making, that potentially important part of social capital is relationships within a family, and this won't capture it. Now remember, we did have, I think we had some doubts on Friday just about some of the parts of this, what are they measuring? But this is a widely used measure.